What is SAMS? SAMS is a SARS-CoV-2 and multi-pathogen serosurveillance survey that aims to learn about how many people may have been infected with or vaccinated for COVID-19 and other infectious diseases in your community in South Africa. Data for SAMS will be collected from each participant at 3 different time points in 2022 and 2023. The study is being done by Genesis and Epicentre, together with the National Institute for Communicable Diseases. What is seroprevalence? Seroprevalence refers to a blood test that tells us if a person has antibodies against COVID-19 or other infectious diseases, either through infection or vaccination. This is done by measuring your body's response, measured by levels of soldiers, called antibodies, specific to those diseases. Why is SAMS important? Infectious diseases are caused by different germs, virus, bacteria, or parasites. Infectious means that the illness be passed from one person to the next. One of these infections is COVID-19, which is the disease caused by SARS-CoV-2. There are also other infectious diseases that we get vaccinated against as children to protect us, such as whooping cough, measles, and polio, and other diseases such as influenza that cause respiratory disease, mostly in winter, and for which there are new vaccines every year. There are still many questions that need to be answered about COVID-19 and these diseases. This study will help us design ways to better protect the community from infectious disease. Where is SAMS being conducted? SAMS is being conducted in 2 provinces, Gauteng and the Eastern Cape. We will enroll 1,500 individuals per province who can participate. Using maps of the provinces, house locations have been randomly selected for participation. One individual from each household will be randomly selected to participate. Participants should be willing to take part in all 3 study visits. How long will it take? The study procedure will take about 40 minutes to complete. The procedure will include a questionnaire to record information about your age, health, and what vaccines you have received. We will also ask to collect a few drops of blood by pricking your finger. A randomly selected group of people will also be asked to provide a tube of blood from the arm. Participation is voluntary and you can withdraw at any time. It is important to note that all information will remain confidential. How will the findings be used? The findings from the study will be shared with decision makers in government and the private sector to assist with the fight against illness caused by germs, including COVID-19. How can you help? If you are eligible, we would like you to participate in the study if you are randomly selected.